Welcome to all of you. Thank you for being here. I'm Dr. Del Giorno. Let's talk about fascial counterstrain. This is one of my favorite topics in medicine because incorporating this skill into my medical practice has dramatically increased the ways I can improve the lives of my patients. Even after using it several years, it still amazes me. And patients are amazed too, with the same day, surprisingly easy relief they get. They leave the office happier because they feel better. Fascial counterstrain fills in some really important gaps in medical care. My goals today are to introduce this very sophisticated therapy and share with you the variety of ways it improves health so you can decide whether you'd benefit from fascial counterstrain. Just so you know a little bit about me, I was born and raised in Maryland, and I've practiced as a primary care pediatrician here for 30 years. One of my favorite things to do in medicine is to scrutinize up-and-coming innovations. I'm always on the lookout for better tools that improve the medical care of my patients. Every so often, a medical tool comes along that really is actually as safe and effective and powerful as it claims to be. Fascial counterstrain is one of those great tools. So I invested several years in training and eventually opened my Wellwounds office so that I could treat adults and children using it. Let's start by talking about health tools in general so we can place fascial counterstrain in context. Our best healthcare tools, by far, are still the ones we have the most control over. When we sleep well, exercise well, eat well, drink water, and support our souls, we are doing the best work we can to stay healthy and in an uninflamed state. And when things get tough, we have some great medical tools when we need them. We use medications, medical consults, mental health therapy, medical devices, surgeries, and hands-on therapies like speech, physical, and occupational therapies. So fascial counterstrain is another medical tool, and the quality that really sets it apart is that with it, I can find and relieve inflammation in the body anywhere it gets stuck. And relieving stuck inflammation is really great news for patients. Meet Julie, star athlete. Life was good until that slippery Saturday morning during the playoffs. Sprinting down the field, Julie just needed a little bit more leg extension and a tiny bit more knee twisting to pull off her winning goal. And acute injury is one simple way inflammation starts. When we get injured, our bodies pull a loud, all-hands-on-deck fire alarm. Our bodies will pull that same fire alarm in other scenarios, like lack of sleep, eating foods that don't agree with us, having a few really stressful days in a row, getting a new infection, and so on. The body responds to the fire alarm by sending inflammation-loaded fire trucks that race through the bloodstream to the site of the injury. The whole team gathers, bringing all the materials, firefighting cells, inflammatory proteins, and fluids. Here's a partial list of them. The area gets crowded and restricted and overheated and swollen. The body reports the activity to the brain, and the brain sends back pain signals to make sure the body stops and rests until the fire is put out. Only when the fire is put out and the damage is cleaned up will the body ring the all clear bell. And we end up with a happy knee and a happy ending, but not always. The body's inflammation system is not perfect. It doesn't always clean up every fire completely. Sometimes we are left in a stuck state with persistent chronic inflammation. And that doesn't just happen with injuries, it happens with a lot of other more complicated problems. In fact, we are discovering that chronic inflammation is a huge player in the most common chronic problems we have today. With these chronic problems, we can still feel pretty lousy, even though we are trying our best to make great lifestyle choices and use all of our other medical tools. And chronic inflammation is an extremely difficult opponent to beat sometimes. Medical professionals can run out of medical tools that can help. It's frustrating for both the provider and that patient. Fascial Counterstrain is a tool that fills this gap really, really well. With Fascial Counterstrain, I'm able to discover the precise, specific, anatomical restrictions that are most stuck, and then gently release them. This could be a restriction around an artery, a nerve, an organ, or any other structure you see listed. Once the inflammation is released, it's transported through the bloodstream and eliminated the same way it would have been in the happy knee story. I think of it as the late to the scene cleanup crew. At the site of chronic inflammation, the fascial system, which is the supporting structure of the body, is still a constricted mess. Fascial Counterstrain allows me to look in all the corners and clean up all the restrictions that are still cramping the normal functions of the body. The technique is gentle and safe enough for infants, for those in pain, and for seniors. And it's reliable, verifiable, and effective because human anatomy is pretty dependable, and that's what it relies on. The easiest way for me to describe how the manual therapy releases work is to show you this toy. In this finger trap, the seemingly obvious answer to getting your fingers out is to pull. But that just increases the tension in the system. It tightens the paper and restricts your fingers even more. Only by moving fingers counter to the vector of restriction can you actually slip them out. This is what Fascial Counterstrain does. The provider spends the time to find each restriction and then holds the correct counter vector for 20 seconds or so, which allows the inflammation to release. It's like finding pebbles in a shoe. Until you find every pebble, it's not going to feel comfortable to walk around. Dysfunction that's been around for many, many years can require more releases to resolve. Childhood dysfunction is sometimes less complicated. In my experience, most people feel relief with Fascial Counterstrain in 1 or 2 or 3 sessions. Once the dysfunction is found and fully relieved in a Fascial Counterstrain session, I will tell that patient that they should expect the relief to be permanent. I say this with confidence because the body's normal state is uninflamed. Remember our inflammation story. Our bodies won't send out the inflammation fire trucks unless there's a new alarm. Some people, though, have chronic medical conditions that are known for dumping new inflammation over time. For example, Crohn's disease. Their fire alarms are always ringing a little bit. They can get great relief from Counterstrain, but they may need more help in a few months to tackle the new inflammation that their bodies keep producing. Every once in a while, a local problem is actually more complex than it initially appears to be. For example, a person whose only complaint is wrist pain may get better with local treatment, but they are very likely to return with repeat symptoms if the real root cause of their wrist pain was actually an inflamed nerve that runs from the wrist to the back of the neck. That neck issue can still be helped once the provider investigates that upstream problem. Fascial Counterstrain is the most individualized therapy I have ever applied. No two people need the same releases, even if they look like they have the exact same injury. There are over 900 different techniques, and it is training and experience that allows the provider to discern which ones are the most important to the person in front of them. I'll speak about a few ways I've used fascial counterstrain to improve health, and then I'll open it up to questions. It's very satisfying to have someone limp into the office, get treated, and actually run back out. But my takeaway after treating many athletic injuries is that prevention is really the key. My physical exam skills with fascial counterstrain help me find important movement restrictions people may not even realize they have. I relieved a shoulder restriction that a Metro's level swimmer didn't realize was limiting his butterfly stroke. I released hip restrictions in a track runner who was extremely happy with her improved stride. It's made me question whether acute injuries are really just the last straw for a body that already had restrictions but was still attempting to play. So I use fascial counterstrain to assess all levels of athletes to prevent overuse and acute injuries. Did you know that 2 to 4% of teenagers still wet the bed almost every night? No, you wouldn't know. It's the best kept secret that only the closest family members get to know. Even pediatricians aren't told sometimes because it's too shame-provoking to bring up in the office. Sleepovers and outdoor ed are just avoided. Families are dealing with daily laundry and they're very weary because of it. I'm in the process of publishing my clinical work with 3 adolescents who had wet the bed consistently every night, and now, after fascial counterstrain therapy, no longer wet the bed. Fascial counterstrain has profoundly changed the lives of these teenagers and their families. Concussions are inflammatory events. The pockets of inflammation found are not something you would see on an MRI or a CT scan. All of the cranial nerve pathways and all of the vessels that enter and exit the skull have fascial counterstrain techniques that address the inflammation there. It's one thing to say fascial counterstrain improved the headaches and the dizziness post-concussion, but when a teenager returns to my office and says, "How did you help me think better?" I pay attention. When the same teenager says, "Dr. Del Giorno, you don't understand," I actually think that I think better than I used to think. We discovered that that particular teenager did not just have the one concussion that he remembers. His mom remembered a very significant other head injury when he was 7 years old. It's my best guess that fascial counterstrain cleared up the after effects of 2 concussions, not just the most recent one. Postural orthostatic tachycardia syndrome, or POTS, is affecting many adolescents these days. It comes with dizziness, lack of energy, poor sleep, and many, many other problems. POTS and many other chronic syndromes can cause day-to-day drudgery for the people that have them. Fascial counterstrain is not a cure that I can apply to make these problems go away forever, but people with POTS, inflammatory bowel disease, rheumatoid arthritis, chronic regional pain syndrome, other chronic pain, migraine and tension headache syndromes, snoring, and sleep apnea are truly grateful when fascial counterstrain can give them months of relief from their symptoms. I believe we undervalue a person's needs for temporary relief. Finding daily joy is important. This looks like a cute picture until you realize that this baby is an advertisement for torticollis. She can't straighten her head. Her neck is too restricted to move that direction. The best option for babies with severe torticollis was to spend the first 6 to 8 weeks of their lives at the physical therapy office stretching and straining muscles to get this to resolve. It's painful for the baby. It's not pleasant for the parents either, because they're supposed to continue the exercises at home. In 30 to 40 minutes, and with no tears, I have eliminated head tilts like this one in the office with fascial counterstrain. Traditional physical therapy is a great tool for lots of conditions, but I believe fascial counterstrain surpasses it hands down when it comes to babies. I had a big, strong football player in my office one afternoon. He was there with his mom. The air was thick with the anxiety he always carried around with him. He hid it pretty well under his macho exterior, and he certainly wasn't there to talk about it. He was there to get a pre-op clearance for an elective surgery he needed. I asked him and his mom if I could treat him with my newest tool. Sure enough, his vagus nerve and his sympathetic nervous system were quite restricted. Knowing his body would feel better going into surgery in a more relaxed state, I worked to relieve it. He fell asleep on the table. When he woke up and sat up, his mom was amazed. His shoulders were relaxed. His face was relaxed. His voice was calm. He felt great. Mom said she hadn't seen him smile so big since he was little. Mental health is affected by inflammation, and so it should be relieved of its chronic inflammation to help the body manage it. Thank you all. I hope this was a helpful introduction to fascial counterstrain. In my office, it can feel like magic sometimes. It's not magic. It's anatomy at work. Wellwinds.com is my website that has all the details you'd need if you'd like to book an appointment. I've tried to make the process as easy as possible. The quickest way to ask me a question is to reach out to my email address, connect@wellwinds.com. Thanks again.